In the wake of the pandemic, Uganda has seen a surge in digital health innovations. Traditional systems have given way to modern platforms designed to provide timely medical advice and safe access to medications, all while navigating the challenges of outdated laws and limited connectivity.
For example, when it comes to telemedicine, enable remote and underserved communities to be able to consult a specialist, for example, virtually, and then they can be able to, receive that specialist consultation. That helps to expand the access and, reach of those remote, underserved communities.
The government, in collaboration with agencies like the Ministry of Health and the National Drug Authority, is working to regulate online pharmacies and telemedicine services. Daniel Aguma, a senior pharmacist with the Ministry of Health, explains that much of Uganda's legislation was written before the digital age.
For example, the National Drug Authority Act is 1993. By then, we did not have all these WhatsApps and platforms and the Jumias and everything that we currently have. So the one biggest challenge is that we have a new practice which is critical to public health, but is being regulated by, for lack of a better word, an outdated law.
Aguma warns that without updated regulations, there is a risk of counterfeit medicines and unauthorized sales. That's why government officials are pushing for guidelines to ensure online platforms meet the same safety standards as traditional pharmacies.
Once the guidelines are approved and ready to roll out, I strongly believe that the Ministry of Health will work together with the National Drug Authority, because that is the other regulatory authority involved in this particular process, with the implementing partners who have been supporting the work, but also, most importantly, bringing on board the e-pharmacy operators and the online channel operators in a conversation to really go through and communicate to them in a very easy to understand manner what the guideline is looking to achieve.
Digital platforms present an opportunity for unscrupulous individuals to take advantage of unsuspecting clients. So we are going to have the risk of the sale of counterfeit medicines, the sale of prescription-only medicines in an illicit manner is very high. The risk of relabeling and selling expired medicines. So the risk is generally high to public health.
Abiaz Ruamwiri of the National Drug Authority shares a similar view. He explains that every digital health service must be subject to strict controls, from verifying prescriptions to ensuring that only licensed pharmacies operate online.
To protect the patient. One, from the commercial interests, but also from harmful products that they are not on their own able to verify. So one of the key things is that you must be having a physical pharmacy that has been licensed, that has followed all our licensing guidelines for your pharmacy. Having a qualified supervising pharmacist, making sure that the drugs that you are actually putting on online are those that we have approved in the country to be on our market. But also you should also have your system should be linking to the National Drug Authority system.
That's PSU's role to be champions of pharmacovigilance, and that involves receiving, reporting, and attending to adverse drug reactions, which may come from substandard medicines or misuse of good quality medicines. So PSU is on the front line, really doing that every day. On top of that, and very importantly, is that PSU is training and always trains the auxiliary pharmacy staff, as well as especially the pharmacists who sit in these pharmacies.
Real-time monitoring and periodic audits are set to become the norm as officials work to keep pace with rapid technological changes. But while the city benefits from advanced digital infrastructure, rural communities still face connectivity hurdles.
We still suffer from the challenges associated with importing solutions that are solving the problems in another country and think that those answers to the other people's questions is necessarily the answer to our own questions. So we have, there should be some efforts towards encouraging homegrown solutions for our own problems.
In rural districts, limited internet access means alternative solutions are critical. The government is exploring SMS and USSD channels to ensure that even remote communities receive timely health updates and access to services.
As Ministry of Health, we are rolling out, I'd call them electronic devices to these people that they are using for capturing information of the people that they serve. But these devices are essentially mobile phones that can be used to reach the people in that area. It's a single mobile phone in the hands of a VHT, but that VHT has reach to all the people in that village.
Digital health isn't just about technology, it's about care. Healthcare professionals like Dr. Faith Chakunzire of Rocket Health stress that expert clinical oversight remains essential. They warn that while telemedicine makes healthcare more accessible, proper diagnosis and prescription verification are key to patient safety.
The general public might perceive fever as malaria. So someone has a fever and they reach out for anti-malarial drugs. So the doctor can reach out to that patient, to that client, and make sure that they actually have malaria, not just the fever, and then provide the right medication for the right condition.
Digital health is also capturing the youth's imagination. Organizations like Via Health Uganda are harnessing social media channels to deliver accurate reproductive health information and immediate support. Cyber educator Joyce Namitala explains that engaging young people online not only informs them but also builds a community centered on safe, confidential care.
Yes, we have our pillars as VIA on SRH, sexual reproductive health, but at the end of the day, much of what we throw out there is what the clients are asking for.
Esther Auma, a regular user of the platform, shares how this digital approach has provided a safe space to discuss sensitive health issues, transforming her experience with healthcare.
For example, I made fear and I'd be like, they will judge me. So if I'm on a platform, I feel free to talk to the health workers and to also socialize with my fellow women and girls.
From urban centers to remote villages, the digital revolution in Ugandan healthcare promises safer, more accessible services for all. But success will depend on continuous collaboration between government, industry, and the communities they serve. As regulators work to update laws and local innovators expand access, digital health stands to transform lives. Walter Mwesigye, NTV.
Thank you.